Good afternoon. My name is Shannon Jones. I am the Interim Communications Director for the Bloomberg American Health Initiative. I just want to thank you all so much for joining to be a part of today's session, Advancing Public Health Training and Research by Indigenous and Allied Scholars in Tribal Communities. I'd like to first start out by acknowledging our faculty who are here with us today, our Bloomberg Fellows, my colleagues who I work closely with from the initiative team. Today's event is extremely important for us in that it allows us the opportunity to highlight the work of our faculty and our Bloomberg Fellows here at the school. Their work is centered around the advancement of well-being, of health and well-being of the tribal communities. And what's most important about this event today is that we have the opportunity to connect, engage, and to meet all of you all who are joining. Before we get started, we'd like to begin by acknowledging the land that the School of Public Health inhabits. Land recognition helps us recall the sacrifices that Indigenous peoples have made and their continued significance as part of our community. Land recognition is just one way in which we can appreciate the contributions and counter the erasure of Indigenous peoples in our society. And at this time, I'll turn it over to Allison, who will guide us in the land acknowledgement.
Thank you so much, Shannon, and so glad everyone is here together. I'm honored to give the land acknowledgement today. As we gather virtually from across the country, we acknowledge the Indigenous peoples of our homelands. We are all on Native land. And today, we humbly acknowledge that Johns Hopkins University is located on the traditional and contemporary homelands of Indigenous peoples. Our campus resides on unceded lands of the Piscataway and Susquehannock peoples. We recognize the enduring presence of more than 7,000 Indigenous peoples in Baltimore City, including Piscataway, Lumbee, and Eastern Band of Cherokee community members. Together, we acknowledge the history of genocide and ongoing systemic inequities while respecting treaties made on this territory as a step towards reconciliation and strengthening relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nations' sovereignty and right to self-determination. We aim to hold ourselves and our university community accountable to tribal nations. Thank you.
Thank you, Allison. Throughout today's session, we welcome you all to use the chat feature to ask questions and provide comment as our fellows and faculty are providing their presentations, as well as our the initiative team. And to get us started, let's warm up the chat feature by, we would love for you all to drop in how you heard about today's event. And while you are adding that information, I'd like to turn it over to my colleague, Shane Bryan, who's our Partnership and Engagement Officer, and he's going to talk a little bit about the initiative.
Thank you so much, Shannon. Hello, everyone. It is a true pleasure to see and be with you all today. My name is Shane. I'm the Partnership and Engagement Officer with the initiative, and I just want to provide a brief overview of the Bloomberg American Health Initiative, talk a little bit about the Bloomberg Fellows program, and then you'll have a chance next to hear about the Center for American Indian Health. So the Bloomberg American Health Initiative was founded back in 2016, which was the centennial year of the school here at Hopkins. And thanks to a gift by Bloomberg Philanthropies, we were able to establish this work, which seeks to improve the health of communities all across the country. We do that by focusing our energies in 5 areas. We call them our focus areas. They're addiction and overdose, adolescent health, environmental challenges, obesity in the food system, and violence. So all of our work falls within these 5 areas. And you'll have a little bit of a chance to hear about some of the work that fellows and faculty are doing in those areas here shortly. But I want to just share with you that when we think about the focus areas here at the initiative, we take a very broad approach to the way that we understand and believe that your work can fall within those areas. And I have a few examples that just to share. So when we talk about environment, we're most certainly thinking about air quality and climate change, but also for environment, where we want to think about how a community's built environment affects the health of those who live in that community. For violence, it's most certainly intimate partner violence and gun violence, but also in what ways are structures set up that violate and target certain communities, and how can we take a public health approach to dismantle those systems. And so across the 5 focus areas, that's the approach we take, a broad approach and understanding and looking at the way that your work falls within that area. And you're also going to hear in a little bit about the Bloomberg Fellows program, how you can also apply. And so as we're chatting, just think about how your work could fall within those areas. And then we'll talk to you about how you could become a Bloomberg Fellow. So we have the 5 focus areas. We also have our 3 cross-cutting themes: equity, evidence, and policy. For equity, we want to ensure that we're working in and with communities all across the country, and tribal communities, urban, suburban, middle America, in our US territories. We also want to think about the folks that we're working with and ensure that they're coming from a diversity of lived experiences. For evidence, it's all about the data. In public health, we want to ensure that the data is informing our decision-making. And with policy, we're certainly looking at governmental policies, so state, tribal, local, and national policies, but also thinking about how the policies of your organization greatly affect the ways in which that you connect with community. All right, so we have the 5 focus area, our 3 cross-cutting themes, and I just want to briefly talk about our 3 approaches. We do research, practice, and education. For research, we're funding faculty to connect and work with communities all across the country. Practice, we're bringing in faculty with a diversity of backgrounds and experiences to mentor our fellows and connect with our collaborating organizations. And for education, it's the Bloomberg Fellows program, where we fully fund 50, that's 50, MPH students and up to 8 to 10 DRPH students every single year. And we're looking for those of you who are on the ground in your community working to improve the health of those around you. And today we're going to have a chance to hear from 4 of our fellows who are doing just that, and 2 of the faculty members who are also supporting tribal communities. I just finally want to share that our fellowship program is impact-based. It's not just your scholarship program. We have a number of different ways that we support our fellows. You'll hear about some of those, either through academic support or financial support to get projects off the ground. And we support a national network. Fellows, when they apply, have to be working already with an organization in one of these 5 areas. And that organization has access to some of the leading minds, either through faculty or other organizations doing similar work. So we're setting up this national network of practice. Again, that's just a very brief overview of the Bloomberg American Health Initiative. You can certainly learn more on our website or reaching out to any of the folks who will be chatting with you all today. But now I'd actually like to turn it over to Allison Barlow, who's going to talk to us a little bit more about the Center for American Indian Health.
Great, thank you.
Oh yeah,
thank you. And welcome everyone. I see people are still joining, and that is wonderful. I'm going to give some brief background on our Center for American Indian Health here at the Bloomberg School of Public Health. And I know I have a few colleagues joining in from our tribal community partners, and I'm thrilled to see you guys. So let me just go to this. Okay. Sorry. Okay, can everybody see that?
Yep.
Excellent, thank you. So our center was founded at the School of Public Health, which is now called the Bloomberg School of Public Health, in 1991 by Dr. Matthew Santosham, who's a pediatrician and infectious disease specialist. We work in partnership with Native communities to raise the health, education, and health leadership to the highest possible level. And this is in deep respect for tribal sovereignty. We really try to focus on strengths-based solutions that honor and promote tribal well-being. Our center has 3 core arms: an infectious disease prevention arm, a behavioral mental health promotion arm, and a training and scholarships arm. So I'll take you briefly through those that are in light blue, and then end with our training and scholarships program that I think will be most relevant to this group. So our tribal partnerships really focus on designing programs from the ground up for promoting health across the lifespan. And we've created many, many programs over the years with tribal partners that have been able to scale to many other communities. Our original work was anchored in the Southwest with primarily the Navajo Nation and White Mountain Apache communities, also with San Carlos and Santo Domingo. And we have more than a 40-year relationship with those communities that began in 1980. However, a lot of the innovations from those communities have now been able to scale and be adapted by Native American communities across more than 21 states. And today I'm calling in from our Duluth site. It's our Great Lakes Hub that's run by Dr. Melissa Walls, who's a Bloomberg professor, and she'll talk to you later. But this hub is serving 11 Ojibwe communities with really innovative research that is really groundbreaking in the United States. Key areas that our center focuses on is healthy children and families, infectious disease prevention during COVID. We pivoted our 250 plus staff completely to COVID relief for almost a year. We're pulling back some now to restart many of the other programs, but it's been a major effort within our center. We have youth empowerment programs, big focus on mental health promotion, burgeoning programs in environmental health and water security, workforce development and leadership, which includes a very unique Indigenous-based youth entrepreneurship program, a scholarship and training program, and continuous capacity building and elevation of policy and practice to promote tribal autonomy and sovereignty. So now I'm just going to delve a little bit into our training and scholarship program. This program is directed by my colleague, Kristen Speakman, with Olivia Trujillo and Anna Sunbow. So our training program is really evolving over the years. We launched it in 2000. We got an endowment from a grateful a donor, and that endowment has allowed us to build this program. This program goes from high school all the way through faculty development. A huge focus of our center now is in recruiting and supporting Indigenous faculty. We have undergraduate summer internship programs that work both at Johns Hopkins in Baltimore in our offices there, but also field internships across different communities. We have a very popular Graduate Institute and Public Health Certificate program. I'm going to tell you more about that. If you're in the MPH program, you can take these Indigenous focused courses as part of your MPH training. We have a graduate and doctoral scholars program that includes an allied Native Circle student and faculty group to promote Indigenous well-being within our community at Johns Hopkins. And again, as I mentioned, Indigenous faculty development. So really trying to increase the Indigenous leadership within our center. Just briefly, we've been able to support more than 1,800 Native students to come and attend institutes at Johns Hopkins that are run by our center. We've supported 28 master's and doctoral students who have graduated from Johns Hopkins programs. Now 106 who have taken our certificate program. We have supported 15 diversity summer interns. Our students represent more than 48 tribal communities in over 30 states. We also have a tremendous group of associate faculty. So most of the institute courses are taught by Indigenous faculty who come from institutions all across North America. And our students also have represented Indigenous peoples from Mexico, Canada, New Zealand, and Australia. This is just a picture of the last time we were able to gather in person with our institute scholars during a winter institute in January 2020. And quickly, this is a group of these are an 18 credit certificate program that focuses on 11 different courses. So it starts with an interdisciplinary approach to understanding the health of American Indians, but then covers every core concept and construct of public health, ranging from data methods to research ethics to mental health care, mass media, early childhood research, policy, and community-based participatory research, as well as unintentional injuries. This is just a quick snapshot of our current Native American full-time faculty. As I mentioned, we have 20 additional associate faculty, but we're really proud of the progress we're making in recruiting additional faculty, which is so important to the well-being of our entire institution. And the future is bright. We now have 12 Indigenous masters and doctoral scholars who've just accepted to come for their MPH, MSPH, and PhD and DRPH programs next year. Here's a list. I saw Alicia Snetty's joined us, so welcome, Alicia. We're so glad that you'll be part of our matriculating scholars this coming year. So our website is listed here. The future is Indigenous, so we really want to support the continued growth of indigeneity at Johns Hopkins University. There's such important scholarship that comes from Indigenous communities that is really the original architecture of public health. I think the concepts within Indigenous value systems are critical and crucial to the well-being of the planet and all living things. So thank you so much. This is a beautiful picture of Hope Canyon in just outside of Chinle on the Navajo Nation and Hickey. Thank you.
Thank you, Allison. Thank you so much for sharing the history and some of the amazing work that you all are doing with the Center for American Indian Health. At this time, we are going to transition to our fellows to hear briefly about the work that they are doing in their communities. So first we'll hear from Brady Garrett. Brady is a part of our first Bloomberg Fellows cohort. Brady works as a psychologist at the Cherokee Nation Behavioral Health, and he's a part of our addiction and overdose focus area group. Then we'll hear from Braden Hickey. Braden works as an environmental health officer with the Albuquerque Area Indian Health Service, and her focus is environmental challenges. Then we'll hear from David Harvey, who is the Deputy Director of the Division of Sanitation Facilities, Construction at the Indian Health Service here in Rockville, Maryland. His focus is environmental challenges. And lastly, we will hear from Renee Begay, who works as a professional research assistant with the Centers for American Indian and Alaska Native Health. And Renee's line of work focuses on obesity and the food system. Brady, over to you.
Okay, thank you, Shannon, for that introduction. And I'm really happy to have this opportunity to share with everyone a little bit about my background and experiences as a Bloomberg Fellow. So again, my name is Brady Garrett, and a little about kind of my background. I'm originally from Oklahoma, born and raised, lived here my entire life with the exception of the 5 years that I was in New Mexico during graduate school. And I'm an enrolled Cherokee Nation citizen, and my graduate training is in counseling psychology. So I'm a licensed psychologist here in Oklahoma, and I've been connected with Cherokee Nation, either their behavioral health department or their public health department here as of recently, going on, I think, close to 20 years now. Kind of thinking back to when I was doing some job shadowing, behavioral health, trying to figure out what it was I wanted to do. I did some practicums here. I did my internship for my master's degree in clinical psychology. And so, it was really clear to me, I think, from a very early point that this is where I wanted to be. I wanted to work with the Cherokee Nation and serve tribal communities, of which I'm a member of. And a little bit about what I do and where I work currently. So I'm with Cherokee Nation's Public Health Department here in Tahlequah, Oklahoma, which is located in the northeast sort of corner of the state of Oklahoma. And they're my partnering organization for the fellowship. And we're really proud to say that we're one of 4 accredited public health departments, tribal public health departments in the country. So it's something that we're really proud of. And some of the, I guess, non-fellowship things that I do here are being a part of and working on a couple of different grants. And we're also looking at compiling community health assessment data to be able to kind of standardize those data and present them to community members and our tribal stakeholders and health service administrators. And we're also in the process of reaccreditation. So that's been a really interesting experience for me, learning about that process and kind of getting exposed to all the details that are associated with that, which there are a ton. And obviously, I was a part of the COVID response team for Cherokee Nation most of last year, beginning of this year, obviously helping with doing contact tracing, data management, dashboard development, and some kind of surveillance data. So my experience with the fellowship, so as Shannon mentioned, I was among the first cohort of 8. I think that was back in 2017. And so it's amazing to see how the fellowship has grown over the years and how quickly it's grown. My focus, as was mentioned earlier, is addiction and overdose, and doing the MPH program on a part-time basis. And so my overall experience, kind of thinking about this question was that it's been just absolutely amazing. The training has been top-notch. It's customizable, and I think that, at least for me, and in going part-time, it was this opportunity to be able to have a sort of direct application of what I was learning. So it wasn't like when I was in graduate school for my PhD in psychology, where I had to finish that and then eventually get a job. So I'm kind of working. I'm in the trenches, and also learning and acquiring these skills from the MPH program, again, being able to implement them immediately, which is awesome. And so kind of for me going into the fellowship, one of the questions that I had was about how to get good data, or just, data in general. And then once I have that, what do you do with it? And, we know that in tribal communities that existing data are incomplete. Access to tribal data is very difficult. Here at Cherokee Nation, I'm fortunate to have some access to some data, community health data, or patient health data. So kind of some of the questions I'm asking myself at that point is, okay, if I have access to data, what's the best way to organize it? What do I do with it? How do I analyze the data and present it to my boss, or to tribal health administrators, or to tribal council members, to inform really important decisions that we're trying to make to improve the health and well-being in our community? And so that was a big point, or I guess learning objective for me in the program. And so it made sense to try to take as many epi and biostats classes as I could to sort of get a sense of what I needed to do, and how to make sure and ensure that I'm presenting this information in the best possible way to make the most positive impact. I think that the staff overall have been just immensely supportive. Varia, Michelle Spencer, Shannon, Shane, everyone, the whole team, they're committed to your success in this program and the process and the mission in general. And I also just really felt a strong sense of belonging, I think, too, with being at Hopkins. Even at this stage of my career, I struggle a lot with, the term, I'm blanking on the term, sorry. But just with not feeling like, maybe I deserve, to kind of be where I'm at. Imposter syndrome, that's the term I'm trying to think of, sorry. So I was struggling with imposter syndrome. And, I think that was, every time I was on campus or involved in any kind of way with the fellowship, that kind of feeling really just kind of drifted away. And so it really kind of made me feel comfortable being there and in a part of this process. I've had some amazing, and continue to have some amazing opportunities for faculty collaboration. So been able to work with folks on publishing papers. One paper recently about access to medication for opioid use disorder among American Indians across the country. Had a chance to connect with Allison and her group at the Center for American Indian Health there. And last but certainly not least, getting a chance to work with Melissa Walls and John Allen on this project, that that was just recently funded on estimating injection drug use in tribal communities. And so I'm really excited about the opportunities that have really come about just by being a part of this amazing opportunity and program. So I think with that, do I just pass the torch or?
Yeah, thank you, Brady. Wow, thank you so much. To hear you say you started out when there were only 8 fellows and now we're at 153 over the course of just a short amount of time is really it speaks to the growth of the initiative and also just the extent of work that you've been doing and implementing in your community. So we're grateful and fortunate to have you speak on behalf of the fellowship program in your organization. So we'll pass it on to Braden and then the rest of the fellows, and feel free to just keep it going. I won't chime in after each one because I want to make use of time.
Sounds good. Hi, everyone. Thanks for coming. My name is Braden Hickey, and as Shannon mentioned, I am an environmental health officer with Indian Health Service, and I work in the Albuquerque area in Taos, New Mexico, and I serve the Taos Pueblo, the Picaris Pueblo, Okeowinge, and I'm also covering the Zuni Pueblo right now. And so our division, the Division of Environmental Health, we basically provide anything environmental health that you can think of to our tribal communities. This includes doing everything from food inspections at casinos to administering rabies vaccinations to dogs and cats, which I actually just did one yesterday. And we also provide technical assistance to IHS hospitals and clinics to help them maintain accreditation. And so we basically act as a mini health department for the tribes, act as consultants or public health advisors, really with the goal of preventing any environmental related disease and injury. So our program has kind of 3 main, branches or focus areas. So we have our general environmental health, which is what I do just as a field environmental health officer. Boots on the ground, inspections, investigations, healthy homes, vector control. Like I said, pretty much anything you can think of environment related. And we also have our institutional program, which is kind of the technical advisory component to our healthcare facilities and kind of our industrial hygiene section. And then we also do injury prevention, which can be anything from trying to reduce motor vehicle related injuries and crashes to child passenger safety to right now working to kind of curb the opioid epidemic. So we really kind of are jacks of all trades here in our communities. And just to tie in with the MPH program and the Bloomberg Fellowship, there's just, as Brady mentioned, you can really customize the curriculum to whatever you want. And I feel like I actually had the problem of I had too many classes that I wanted to take. So it was really hard to kind of narrow down the focus. It's been, such an amazing program to be a part of. And I feel like I've been exposed to really the leaders in public health and in environmental health. And in fact, the Bloomberg Fellowship was where I met Captain Harvey, who I think is going to speak next, 2 years ago at orientation. And through that connection and meeting him, and I was able to get involved in the Navajo Water Access Mission, which took place this past year to help bring clean drinking water to the Navajo Nation. And I'm sure he'll probably talk about that a little more, but it's just a really great way to connect with other public health workers and help us to collaborate and to become a lot more effective in our work that we do every day. So with that, I'll hand it over to Captain Harvey.
Thank you, Lieutenant Hickey, for that handoff. Hey, I want to thank Shannon and Shane for inviting us here today, and Faria and Michelle Spencer. The staff of the Bloomberg American Health Initiative are spectacular. and they are very supportive, as has been said before. And so I'd recommend, if you have questions about the fellowship or anything, you get a hold of Faria and she'll be able to answer those questions for you. I'm, as mentioned, I'm also work in the Indian Health Service. Both Braden and myself are Commissioned Corps officers. That's why we're wearing our uniform. So we also would like to recognize that Rear Admiral Kelly Taylor has joined the call, and she is the Chief Professional Officer for the environmental health category. So she provides guidance to the Surgeon General on recruitment and personnel issues related to environmental health. She is my kind of sponsor for the Bloomberg American Health Initiative. So when you sign up for this as a collaborating partner, she represents the Indian Health Service as the face of me in the event. I've been involved working in water for about 30 years. I started in working in the lowest place of water. I basically the local water district where I painted the fire hydrants in the around the town. It was nice. It was in southern, and it was during the summer. It was in southern Maine, and so I was on the beach quite a bit. But I got a degree in civil engineering from the University of Maine, and I then a master's degree in civil engineering from University of Connecticut. I then did some work in the private sector overseas in an engineering consulting firm, and then later back in the United States with water related equipment supplies firm. So mostly technical things. And then I joined the Public Health Service. Initially, I wasn't in water. I was working in a facility to take care of healthcare facilities. Actually no, a mental hospital. But then I found the Indian Health Service, and I've kind of and water, and I've been kind of attached to that theme for quite a while now. I enrolled in Hopkins for a Master of Public Health back about, I would say 10 years ago, and completed that, and it was a really great experience. It kind of whet my thirst for kind of more learning in public health. It kind of expanded my view of my work in the Indian Health Service and helped me to make connections for the that I wasn't making as just being an engineer, building things. And so it helped me to see what the purpose of my work was, and to kind of help me to translate that. So it helped me, and hopefully it helps the people that were the programs that I'm working in try to help. So currently I'm the Deputy Director of the Division of Sanitation Facilities Construction. It's a program that helps tribes to gain access to water, wastewater, and solid waste facilities. We survey the needs annually, and then design the projects, and then help the tribes do oversight and construction. Kind of more recently, there's been work with COVID, and there's been quite a lot of attention associated with the number of homes without piped water in Native American communities. Primarily, those are on the Navajo reservation, as well as in Alaska. Fortunately, in Alaska, the impact of COVID has not been as drastic as it was on the Navajo Nation, and the call to action there, which came from the President Nez and Vice President, asked the Commission, asked the U.S. Public Health Service through the Center for Disease Control and IHS to support. And we did. We've supported through about 40 of these blue suit people, Braden, myself, and I think Lloyd Loop is on too. So I see another alumni of the mission is on the call too, where we went out and assessed where the water points were and what needed to happen to kind of improve access to the safe water. And we've taken steps to do that, and now we're monitoring those activities. And involved in that journey was kind of my support from Johns Hopkins. We've, I routinely would contact and I still do, Natalie Exum, who's on the call, my co-advisor for my my journey through the DRPH world, and also Dr. Kellogg Schwab, for advice on kind of what steps I could take and how to approach the problem. Also, we've made connections with John Hopkins and the tribe, the Navajo Nation tribe, that maybe weren't there before in environmental health issues, and I think the Center for American Indian Health is undertaking some work now with them in the environmental health world, which I know is going to be great and build great relationships and help everyone. So I guess the purpose of the Bloomberg American Health Initiative is to kind of bring practicing, practitioners into academia and can kind of make collaboration. So that's exactly what I'm doing in it, and it's spectacular. And I really invite all of you that have a desire to do that to kind of reach out and figure that out here in this program, because there's plenty of opportunities and plenty of assistance from the university, and plenty they can learn from you as well. So that's all. Thanks. And I don't know who's next.
Renee, you're up next.
Renee. Okay.
Yeah. Hi, everyone. Yate, she Renee began she total nation last year budgeting touching the check on additional. So that I just introduced you myself in Navajo, and my clans are Big Water, and I was born for the Red Bottom People clan. My paternal grandfather's clan is Red Running Into Water, and my paternal grandfather's clan is Towering House. So I'm Navajo or Diné from Solana Springs, Arizona, which is just outside of Chinle, located on the Navajo Nation. And I'm actually streaming right now through from the Navajo Nation. So a little bit about my educational background. I received my BS degree in biology from the University of Arizona, then received a master's degree in clinical science from the University of Colorado Anschutz Medical Campus. While in my master's, I was studying genetic mutations associated with human dilated cardiomyopathy or heart muscle disease. This is where I began my passion for the study of human DNA and how the study of DNA impacts Indigenous communities here in the US and internationally. From this experience, I really realized that I would like to gain an MPH degree to learn how to engage with people on a population level, because working in a lab and in genetics research, it can be very isolating and kind of be done in a vacuum, and you don't really engage with people. And if and right now I would like to work with Indigenous communities, even my own people on the Navajo Nation, to engage in genetics research. And I would like to be able to use my MPH skills to bring equitable research to the community and combine that with my Indigenous and traditional medical knowledge to improve the health of Native people in a holistic manner. So I started the Bloomberg Fellow in the Obesity and Food Systems concentration last summer in 2020, pursuing a Master's of Public Health degree in the online format part-time. I also completed the American Indian certificate that Dr. Barlow mentioned earlier in her presentation. And I'll be soon starting my practicum focusing on obesity and diabetes in youth, and we'll be collaborating between my Centers for American Indian and Alaska Native Health and the Centers for American Indian Health at Johns Hopkins. And Dr. Barlow is actually my advisor for my MPH. So in addition, I work as a professional research assistant at the Centers for American and Alaska Native Health at the school, University of Colorado School of Public Health. My role is also affiliated with the Rocky Mountain Veterans Affairs, where I'm helping to create an outreach program that will help VA employees, such as suicide prevention coordinators, respectfully engage with rural Native veterans and their communities to help veterans gain better access to healthcare services, more specifically for suicide prevention. And lastly, the Bloomberg Fellowship has been really instrumental in providing me with a huge network and financial support that allows me to gain this really amazing graduate education. The courses I've taken so far have not overlapped with my previous masters, have been super beneficial, challenging, but also have been really added to my skill set and knowledge that I did not really, receive previously. I feel like I'm part of an elite group of people, but honestly, it's only felt like a family-like atmosphere, and everyone who is a fellow has this common goal, which is just to improve the health of people across the world. And I really enjoy being able to work in my community and still work towards my degree. Yeah, thank you for having me.
Thank you so much, Renee, and to all of the fellows who have done such an amazing job in your respective roles, and we are entirely grateful for your work and for sharing with our community today. Just want to do a quick reminder for folks. So we have the chat function going, it's active. I love seeing the folks posting in there. We're gonna have a Q&A session at the end. So if you think of a question and you don't wanna lose it, drop it in the chat. It could be about the fellowship program, the Center for American Indian Health, directly to some of the fellows or the faculty, but go ahead and drop in any questions and we'll get to them towards the end. Next, we're going to invite up our faculty members, Melissa Walls and Sean Allen, who will be able to talk to you a little bit more about their work as it relates to tribal communities. So I will thank you all for joining Melissa and Sean, and I believe we're turning over to Melissa first.
Sounds good. Bonjour, everybody. Memengwan and Nishnakaz, Magizi Duadam. It's great to see some Ojibwe faces on here. I'm up here in Duluth in Anishinaabe territory, as you saw from Allison's presentation. Okay, we are running short on time and I want to get through some important messages. The first one is all of the fellows that you heard from, all of the fancy titles and names and things, you guys are super amazing, but so is everybody on this Zoom. And my mission is for us to load Johns Hopkins figuratively and literally with Indigenous people. Like load that place up because we deserve access to the incredible knowledge and legacy of the faculty, students, and staff that come from that system. And I'm part of it now. So I want to tell you very briefly that this fellowship program, this Bloomberg American Health Fellowship Program, was the model that allowed me to become a faculty member for an East Coast institution, but stay and live and work where my heart is, which is in Anishinaabe country. So with collaborations between the center, Allison Center, and the Bloomberg Philanthropies and this fellowship, this endowment gift that Shane mentioned, and of course negotiating with the university, I was able to negotiate an offer where I could stay, live, and work here in Duluth and still be a faculty member for Hopkins, which means I do teaching and all of the things that used to feel really weird on Zoom, but now we all live on Zoom, so it's like no big deal. So the model is, as you're hearing, you get to live and work in your home, in the homes that in the communities you're serving, and yet still have access to the amazing minds and coursework and resources of this system. And Renee, you said this feeling of family, despite all of the accolades and all of the experiences. So true. I could not agree with you more. I feel so welcomed and so I've never felt so inspired actually to think big and to come up with a big idea and have people say to me, yeah, let's figure out a way to do that. I think we can do that. We're going to find ways to do it. It's just such a refreshing thing. So if that's you, if you're in a position where you're like, you know what, there's some big ideas in my head and I feel like we could do this, this is the place for you. Or if you just want to nourish those small ideas and watch them become big dreams, like this is such a cool program. So Shane, I didn't talk about my research, the research I do with communities, but I'll put in the chat two things. One is the little link to our hub through the Center for American Indian Health. We do research here in collaboration with communities on all sorts of topics, ranging from diabetes to mental health to substance use. And because of this program, the Bloomberg American Health Initiative, I met Dr. Sean Allen, who's going to speak next, and also got reconnected with Brady Garrett down at Cherokee Nation. And we were awarded a 4-year grant to work on the opioid epidemic in collaboration with the Boys Fort Band of Ojibwe and Cherokee Nation. And I think that Shannon has a link to a video if you want to learn more about it. And Sean, I think, will speak a bit more about it. But this is all to say that there's so many research opportunities that you can get engaged with. There's so much going on with the Center for American Health that you can get engaged with. I think, as one of the fellows mentioned, the issue becomes, there's so much that just picking the bits and pieces that you can manage. So I just, we're here as a resource to you. Please reach out to me. I'll put my email in the chat as well, but you can read up on the research we're doing through the chat. So I'm going to turf it over to you, Sean.
Hi, everyone. I'm Sean Allen. I know we're running short on time, so I will give you the elevator speech for the project that we're working on. So we are trying to estimate the size and characteristics of the population of people who inject drugs in 2 tribal communities, as Melissa mentioned. We are doing that through a method called capture recapture. It's a method that has been widely used in public health, but it hasn't been used as much in rural areas or in American Indian communities. So we are going to use this method and package the results, and also write up a toolkit on everything that we did, every lesson learned. We are also involving local stakeholders as equal partners. So it's not just researchers coming up with an idea and helicoptering in, doing the research and then leaving. That's not our model. So we are equal partners in this. And I will say that this is my first research project working with American Indian communities, and it has been absolutely amazing. Everyone has been so welcoming, and it's just been a very great experience so far, and we are really looking forward to launching data collection. And I am looking forward to visiting these communities. We would have been there by now, but COVID threw us for a loop. So that is one part of the study. The other part is a qualitative line of inquiry. So we knew that quantitative data wouldn't tell the full story. So we wanted to interview people who inject drugs in each community as well. Really learn about the community resiliency and cultural attributes that are really helping people along in their paths to recovery. So that is the project in a nutshell. I'm happy to answer questions at the end, and feel free to send me questions at any time. If you think about a question, 2 weeks from now, I still want to hear it. I love hearing from students and prospective students. And I will just echo all the great things that have been said about the Bloomberg Initiative. I will also add that it is wonderful to have such flexibility in my research. So a lot of the ideas that I have floated through the initiative have been ideas that probably other funders would not have had any interest in. But it's been incredible working with the Bloomberg Initiative, and definitely working with the Bloomberg Fellows. So with that, I will kick it back to Shane.
Thank you so much, Sean and Melissa. I really appreciate you all. And we're going to keep it moving. So the next part we want to bring in is one of our colleagues, Faria Zaman, who is the fellowship officer. And Faria is going to share some nuggets with you all about how you can apply to become a Bloomberg Fellow. Faria?
Yep, thank you, Shane. Good afternoon, everybody. As Shane said, my name is Faria Zaman, and I'm the fellowship officer with the initiative. And I wanted to just briefly share a little bit about the fellowship program and how to apply, in case anyone here is interested, or you may know someone who may be interested in the fellowship program. So as Shane mentioned earlier in the session, we are looking for individuals who are working on the front lines on any of the 5 focus areas based here in the US for a US organization. And our next call for fellowship applications will be announced on our website and through other means in early August. So keep an eye out on the website for that announcement. And once the next call is open, we will be accepting fellowship applications until December 1st. December 1st would be the final deadline to apply to the fellowship program. And I just wanted to talk a little bit about the application process. It has 2 components. So if you're interested in applying to the MPH, you would apply to the fellowship program and the MPH program together at the same time. So you would submit your fellowship application forms, and we have 2. One is the applicant form, and the other is the collaborating organization form. And at the same time, you would submit all of your admissions materials for the MPH program. And the Bloomberg School uses a system called SOPHIS, which is the system they use to process all of their applications. So all of your admissions materials, your transcripts, your letters of recommendation, all of that would be submitted through SOPHIS. And all of your admissions materials would also need to be submitted by the final deadline of December 1st. And I always tell people to please start your application early to avoid any delays, because sometimes it takes a while for things like transcripts to reach SOFIS and all of that. So you should apply early. The other thing is the MPH program does have some prerequisites. And regarding the GRE, which is a common question. So the last application cycle, the MPH program, they did waive the GRE. Now, I don't believe the MPH program has made a decision yet as to what they plan to do this coming application cycle. So I always advise applicants to reach out to the MPH program to get an understanding of all of their admissions requirements. And so that in a nutshell is sort of the process of applying. And I'm going to put my email in the chat. So if there is anyone here who's interested and you have questions about the fellowship, please reach out to me. And please feel free to share my name and contact with others who might be interested.
Great, thank you so much, Faria. And we are getting some questions in, and I would also say that feel free to use the raised hand feature and ask your question to any of us, as well as if you'd like to turn your cameras on and we can see your beautiful faces. We want this to be a very approachable platform for everyone. So feel free if you wish to do so. The first question that I'm seeing in the chat is a good one. Fellows are required to work with their current organizations for their practicum and capstone requirements. And that's the question. And then can they hear some examples? So the answer is yes, Faria, correct. They do have to work with their organizations. And then I would open it up either to Faria or any of our fellows, quite frankly, to talk about some of the ways that they've worked with their collaborating organization for Practicum and Capstone.
Yes, I would agree. I think some of our fellows here are in the best position to talk about some of their Capstone and Practicum projects.
Yeah, I'll jump in. So for my Practicum project, I worked with the organization here on developing a opioid use disorder dashboard. So we were able to get some access to some data visualization software and receive some training on accessing our patient health record data, and was able to kind of use that in a way to sort of develop these visualizations through Tableau, which is the program that we were able to purchase. For my capstone, I'm looking at ED, or like any use ED visits or presentations among patients with opioid use disorder only, and opioid use disorder plus a co-occurring or comorbid psychiatric disorder. So the kind of hypothesis is that patients with a baseline opioid use disorder diagnosis and a co-occurring mental health disorder like major depressive disorder or PTSD are going to frequent or access or utilize our sort of acute crisis services more frequently. So present to the ED, or hospitalized more, things like that.
Thanks, Brady. Any other fellows want to share about their capstone or practicum experience?
Sure, I can talk really quickly. So for my practicum, I actually was deployed in December to the Navajo water access mission. So we were able to make that fulfill the practicum requirements. So there, I did a lot of work with testing the water for chlorine, doing some train the trainer educational sessions with chapter officials and community health workers. And, if you want to see more about that project, you can go to navajosafewater.org. And there's a lot of the educational materials that were created on that website and some videos and things. And then for my capstone, I kind of did something completely different. I created a questionnaire to send out to all of the federal environmental health staff with Indian Health Service. There was 126 total people we sent it out to. And the goal was to kind of look at this past year and capture the work we had been doing with COVID, since we've never had kind of a response on this scale. I think everyone can relate to that. So it was capturing that work that we did with COVID, and also just giving the staff a chance to reflect and to share successes and challenges and different things that happened this past year. So I sent out that questionnaire and then kind of analyzed the data and worked on putting together a report. So that was my capstone.
Wonderful. Thank you so much for sharing. I got a private message question that came in, and it is, if we have a couple more minutes, if you don't have a traditional track to public health, so this person is interested in the fellowship program and interested in public health, but they haven't taken a lot of public health courses and don't work in a public health agency, and they are wondering if they would be a good fit for this program. So I would open it up to anyone, Varia, Melissa, any of the fellows, if you all have some thoughts.
I met some police officers at the first I showed up there, and I was like, what are they doing here? But, you know, I think there's many connections to public health committee.
I also have no background in public health. I'm a sociologist, and so I'm still a member of the Bloomberg American Health Initiative. Faria, you were going to say something.
Oh, I was just going to say, you know, the initiative is looking for people who are not just working in the traditional world of public health, but also non-traditional public health work. And David mentioned police officers. Yes, and we're getting some more. So we actually have several police officers. We also have librarians. We have social workers, we have engineers, and so we absolutely love getting people who are outside of the traditional world of public health. And I also wanted to add that it can also be any organization, as long as the organization is working in at least one of the 5 focus areas and is based here in the US. You know, it doesn't have to be a nonprofit or anything like that. And you'll see when you check out our website that our fellows come from a very wide, diverse range of backgrounds, experiences, and organizations. And if you are interested in the fellowship, please have a look at the profiles of our fellows on the website, and it'll give you a good idea of the kinds of people we're looking for and the backgrounds that they're coming from.
Thank you all. So we're really getting close up on the time. Maybe one last question, and then we're going to turn it back over to Shannon to take us out. But the next question is, can they do this program on a part-time basis if they're not able to relocate to Baltimore, which I think we talked about really briefly, but maybe we can go in deeper. And then how long does it take to complete the program?
Okay, sure. That's a great question. So the fellowship is open to individuals who are applying to both the part-time MPH and the full-time. So the part-time MPH program typically takes around 2.5 to 3 years, and the program allows up to 4 years to complete it on a part-time basis. And for full-time, it is 11 months. Now, going back to part-time for a second, it's online, the part-time, and the full-time, it's on campus, but of course, because of COVID, nothing's been on campus. And one of the things I want to mention quickly is that the fellowship program, we do ask our fellows to do some of their credits, at least 16 credits in person in Baltimore. We feel it's a really important part of the fellowship experience to be here, to spend some time on campus, to interact and engage with the faculty, with the initiative, and with your colleagues.
Thank you, Faria. We made up time, and I am so excited about it. We have 1 minute left. And I do want to just take this time to acknowledge every single one of you who took out the time to join us. Melissa, thank you for just saying, like, it's not about the titles, it's about us bombarding the school with, you know, people who are dedicated to improve the health and well-being of Indigenous peoples. Thank you for raising that and saying that. And also, like, thank you to our fellows for, you know, just sharing about your work. And Renee, I loved when you just hearing you speak. Sean, Brady, thank you all. Braden, thank you, especially to the initiative team and Michelle Spencer, Okola, Aaron, Polani, the entire team, Shane, Faria. This really is a family, and we really operate as a unit and as a collective. And while, you know, some of our team members, they probably had other things to do, but just to see their names up on the screen, camera off, it still just let me know that, you know, they are there and holding our hand and supporting us in this endeavor. And this is only a snapshot of, you know, the impact and the community that we are fortunate to have here with the initiative. And there are multiple ways in which you all can stay in contact with us. I've dropped a few in the chat. If you want to hear more about the work of our Bloomberg Fellows, Shane and Faria have been producing a series of podcast episodes highlighting the work of our fellows. We're about 12 episodes in, and I think they're short and they're sweet, but it really will give you a sense of how diverse, from police officers to librarians, as Faria mentioned. And also, you know, just stay connected with Twitter. Look out for our American Health Dispatch newsletter. We are easily accessible. So I just want to say thank you again. We have all of your contact information, so you will probably hear from us afterwards with the survey, and we would really, really appreciate your feedback. And if there isn't anything else, it's 4:01. Thank you so much, everyone. Have a great rest of your day.